After liposuction, we are worried about the quality of the skin you're going to end up with. And that's why I have all my patients do two things: roll after lipo and use FiberGuard. Trouble is, when I do arm lipo, FiberGuard is shaped like a waist trainer. It's not going to be good for the arms. So you can't use FiberGuard on the arms. But you can still roll, but you can't roll by yourself. But it's very important to roll the arms after liposuction to get smooth skin. So what I would like you to do is to roll, have someone else roll for you. And you do that by laying down and having somebody roll from the back. So when you're laying on your tummy, and then they'll roll your arms as you're laying on your tummy. And then also you can lay on your back and put your arms out and have them roll on your arms while you're, say, laying on your bed, for example. It's important when you use the roller during the first 2 weeks when someone else is rolling for you. The first 2 weeks, we're gonna have them roll just traditionally. So just like they're rolling out some dough or some pizza dough or something. And so they're gonna roll in that traditional manner on your arms firmly. Not to the point where it's hurting you, but firmly. Then at 2 weeks, they're gonna still roll, but they're gonna do it differently. They're gonna turn on the vibration, and instead of using pressure, they're just gonna use the weight of the roller. Not adding additional pressure, but just use the weight of the roller very lightly, and they're gonna roll in one direction, pick it up, roll it in one direction. Now, which direction? Okay, so the lymphatic drainage, remember this is, when you're using it in this way, high vibration, very light pressure in a one direction. This is acting as a manual lymphatic drainage tool. It's opening up the lymphatic channels. It's getting rid of the fluid. But we have to do it in the correct way because we want the fluid moving in the right direction. And in your arm, the direction is towards your armpit because this is where all your lymph nodes are. So you're going to have your, whoever's doing the rolling, roll it in one direction, light pressure, high vibration. This is starting 2 weeks after. You're going to have light pressure, high vibration, unidirectional, meaning they're going to start in the elbow, go towards the armpit, pick it up, start here, go towards the armpit. That's going to open up the lymphatic channels and suck that fluid into the lymphatic channels, dump them in the lymph nodes where they're going to go to your heart and you're going to pee out the fluid. So it's very important with arms because you can get some lumpiness after arm liposuction. The other thing, and I love when people say this, like pro tip, you know, I mean, but another tip for you is if you have lipo and you put your arm up like this and kind of stretch it, you can sometimes see lines. And when I first saw this, when I started doing arm lipo years ago, I just about had a heart attack. I thought, oh my God, this patient's gonna have this for the rest of their life. You won't, but it's important to massage this with the roller. So while you're laying on your bed in the face down and back down and you're having your assistant do that, also put yourself in this position where you could be sitting in a chair or sitting on the edge of the bed and you've got your arms straight or this part straight and there's tension on it, and have your partner roll this area with the roller. And that can be done firmly, so it's sort of to help flatten those little grooves, and also in high vibration like touch all the way down towards the lymph nodes in your arm. So that's the way you use the roller after having arm liposuction. Super important to do so, but you're going to need some help.